Bismillahirrahmanirrahim. Dear viewers, today my lecture is about review on COVID-19. So, as we all know about the COVID-19, that COVID is coronavirus disease, which is an infectious disease and caused by the SARS COVID virus. Now come toward the basic introduction of the COVID-19. So COVID-19s are coronaviruses. Coronaviruses are a large family of viruses which may cause disease in animals as well as in humans. There are 7 coronaviruses which can produce infection in human around the world, but commonly people get infected with these 4 human coronaviruses, that is 229E, and this one is NL63 and OC43 and HKU1. They are usually cause respiratory tract infections ranging from the common cold to more severe disease such as Middle East respiratory syndrome, that is called MARS, and severe acute respiratory syndrome, which can be abbreviated by SARS, and the most recently discovered coronavirus, that is COVID-19, causes infectious disease. As this disease was originated all over the world in 2019, that's why it is called COVID-19. This COVID-19 is actually, this is a zoonotic disease which is caused by a severe acute respiratory syndrome, that is coronavirus 2, SARS-CoV-2. So the WHO, World Health Organization, originally called this infectious disease novel coronavirus, which is infected pneumonia or NCIP, and the virus had been named 2019 novel coronaviruses 2019 NCOV. On 11 February 2020, the WHO, World Health Organization, officially renamed the clinical condition COVID-19, a shortening of coronavirus disease, which was announced in a tweet. An outbreak of COVID-19, which is caused by the 2019 novel coronavirus or SARS-CoV, which began in Wuhan city, that is Hubei province, China, in December 2019. So the current outbreak is officially a pandemic. So since the knowledge about this virus is rapidly evolving, readers are urged to update themselves regularly. How this virus can be transmitted from one person to another person. So the route of transmission of COVID-19, the virus is typically rapidly spread from one person to another through respiratory droplets and through sneezings. So this is the major route, or this is the major pathway through which this virus can enter, through respiratory droplets and by sneezing. The best way to reduce the chances of infection of COVID-19, that we should isolate from one another, and it is considered the most contagious when people are symptomatic. So although the transmission may be possible before these symptoms show in the patients, time from exposure and symptom onset is generally between 2 and 14 days, with an average of 5 days. So the common symptoms which are reported, that include fever, cough, that is sneezing, and shortness of breath. These are the common symptoms which are developed by the patient after the attack of this virus. Now, what are the different complications related to the COVID-19? So, the complication may include pneumonia, throat pain, and acute respiratory distress syndrome may be occur. So, currently there is no specific antiviral treatment or vaccine. Efforts consist of symptom eradication supportive therapy. So, inshallah, with the passage of times, the treatment protocol will be developed as well as the vaccine. They are also under trial, under investigation. So the recommended preventive measurement include washing your hands with soap, covering the mouth when coughing, maintaining 1 meter distance from one another peoples, and monitoring and self isolation for 14 days for people who suspect they are infected. So in 2019, I have already delivered a lecture on COVID-19 that for COVID-19 there is no specific treatment or no vaccine, but nowadays in 2021 the vaccines are developed and most of the peoples, majority of the people, they are vaccinated. Their immune systems, they are now boost up. So the this is very easy to understand that we should maintain the 1 meter distance from one another, and monitoring and self isolation for 14 days for the people who suspect or they are infected. The standard tools of diagnosis is by reverse transcription polymerase chain reaction, that is RT-PCR, from a throat swab or nasopharyngeal swab. So the infection can be, or it can also be diagnosed from a combination of the symptom risk factors and a chest CT scan showing the feature of pneumonia. So inshallah, in my next lecture we will just talk about the current updates which is concerned with COVID-19, that is there is any treatment protocol and its epidemiology, its route of how it can transmit from one infected person to another healthy person. And there are many and more challenges which is faced by the people, because this is viral disease, and this viral disease, this is not limited but this is all over the world. The situation is pandemic, but now up to some extent the situation is already controlled with the help of vaccination. And inshallah I will try my best to inshallah to continue this lecture. So inshallah in my next lecture I will talk about its treatment protocol, its epidemiology, and what are the precautionary measurements which is needed for each and every individual. Thank you so much for watching my lecture.